Hi, my name is Alex Milhaupt. I am the Blood and Marrow Transplantation and Cellular Therapy Manager of Clinical Programs at Roger Williams Cancer Center. At Roger Williams Cancer Center, we are proud to be the first and only provider of CAR-T cell therapy in the state of Rhode Island. We offer a CAR-T cell treatment called Kymriah, which is a type of immunotherapy made from the patient's own blood cells that are collected from the patient, sent to a manufacturing facility, and then re-engineered to fight the patient's specific type of cancer. There are 7 steps in the process to receive Kymriah CAR-T cell therapy. First, we identify the patient as appropriate for CAR-T cell therapy with Kymriah based on the type of cancer they have and the treatment they have already received. Kymriah therapy is approved for patients with certain types of blood cancers, including young adults with acute lymphoblastic leukemia and adults with DLBCL, which is a B-cell lymphoma, or those with follicular lymphoma who have relapsed, which is where the cancer went into remission and then came back, or the cancer is refractory, meaning the cancer did not go into remission after receiving other treatment. These patients have also tried at least 2 other kinds of treatment. To make the Kymriah CAR-T cell product, we need to collect the patient's T cells through a process called apheresis. For this procedure, the patient will need a central line catheter placed. This is an outpatient procedure where a large bore IV catheter is placed into a big vein to make the apheresis process go smoothly. During apheresis, we have a prescribed number of T cells that we need to collect. The apheresis machine is a cell separator, which identifies T cells, takes them out, and returns all the other components of blood back to the patient. The entire process usually lasts around 4 to 6 hours, and at the end, we take a look at the cells we've collected, count them, and then if the number meets the manufacturing criteria, we're all done. If there aren't quite enough cells at that time, the patient will come back the next day for another collection. When apheresis is complete, the cells are sent to the Roger Williams Stem Cell Lab. They are responsible for freezing, packaging, and transporting the cells to the Novartis clinical manufacturing facility. Novartis re-engineers the patient's T cells into Kymriah CAR-T cells over the course of several weeks. Then they're frozen in liquid nitrogen and sent back to the Roger Williams Stem Cell Lab, where they remain until the patient is ready for infusion. When the doctors say the patient is ready, they will come in for a chemotherapy conditioning regimen a few days before the cell infusion. This will clear out any bad cells that are still circulating and make room for the CAR-T cells. Then it's time for the Kymriah therapy CAR-T cell infusion. Most often, we will infuse the cells over a half hour in the cancer center, then monitor the patient for a few hours. If everything looks good, the patient can go home, but occasionally we will admit a patient for the infusion and for several days after. After the infusion, there is a chance the patient can develop cytokine release syndrome, or CRS. CRS is a known side effect for any CAR-T cell product and can make the patient quite ill. It usually presents within the first week after infusion and can cause fever, low blood pressure, or trouble breathing. The patients could also develop neurotoxicity, which is another known side effect, and that can cause confusion, difficulty speaking, and in more severe cases, seizures. We will need to heighten the level of care the patient receives if they do develop these side effects, and we'll coordinate with intensivists in the ICU to monitor and treat the side effects. In most cases, CRS and neurotoxicity are reversible. In order to closely monitor patients immediately following treatment, we ask that any out-of-state patients stay within 2 hours of Roger Williams for 4 weeks after getting Kymriah. After that, the patient can return home and resume visits with their primary oncologist, with whom we will coordinate any follow-up treatment or monitoring.